drop dead date for the grant. They, as I said in my note when we were at that session, that they said 3 towns, not 2 towns. Although I read it again further in the more detailed explanation, and the state specifically said they anticipated 2 or 3 towns, but we heard on Thursday night 3 towns. So the time is short. And I still have 2 different things on the table, though. One is definitely Emma's offer, and Herb, you just sent out something that you were copied in from Meredith. Is that her name? The
Meredith
director of, yeah, who was anxious to have Amherst take over that vaccinations for the homebound. So that's one issue that was out there. Although Emma's note was saying she wanted to handle it as I think one of the shared services operations. And then there's the obvious shared service grant. And whether we should be attempting to go forward. Like Herb, you've done some talking. I did talk to actually Sharon Hart before, in fact, before you got advised, I think, by Lauren, saying that we ought to talk to Sharon. Sharon was actually upset that it was 3 towns instead of 2 towns. That she said that they were, South Hadley had moved forward and they were about to come up with a proposal to be sharing all inspectors. So building inspector and Sharon's feeling was that there really wasn't enough time to come up and come up with a proposal, especially with the 3 towns that apparently she's in a shared nursing operation already, but it's Hadley was involved as the 3rd town. So her feeling was that Sharon was not interested in moving forward with a grant at this round. But she definitely thought that the important thing for her to be doing right now is to be working with us or somebody else to try to understand what we wanted to do, what the scope of this thing would be, and spend some time. And she actually said if it turns out that to come up with a shared, if Granby and South Hadley make that, she said she would be saying the shared money's not so important if to get this whole thing done properly, that it was a 2-town endeavor. So that's what I learned. Herb, you want to take it right now?
Well, I'm not sure what you want me to say, Dick. I think I don't understand why Sharon wouldn't want to involve South Hadley in a shared services grant. I do understand that she maybe mostly by herself is the Board of Health for South Hadley. And there's only so much that anyone can do. I don't know what that is. I did speak with Emma Dragon, and who Amherst was going to partner with, but if we wanted to share with her what our thoughts were, she would certainly consider partnering with us. As you see from what I wrote today, I tried to put something down on paper so there would be something to respond to. I also thought that since Lynn Dinez works closely with us, that Holyoke might be another possibility to partner with, another larger town. South Hadley being a sort of middle-sized town, ourselves being a small town, Amherst also a larger town, that there was the potential to write a grant here. So that's why I took the initiative today to put a few words on paper for people to respond to see, is this anything that we want to do? Is this way off base? I'm not dependent on these words. They can be anything. I was just trying to move the needle along by writing something so we had something to respond to. Since we have a nice...
When I listen...
Go ahead.
Oh, and a comment on what you prepared. What you prepared is very much what I would think we should be, not necessarily for the grant, but what we should be doing. Yours was pretty encompassing, and it seemed like it was touching when you start looking at the different kinds of inspections, the nursing, the kind of the things that we do that we're short-handed to do properly. And that, I think when I listen to this whole thing and read that 116-page report, which I'm certainly unhappy that something that is so big for the boards of health wasn't thrown up in our face and saying, hey, guys, acknowledge that you've got this. But what they said makes tons of sense. And whether we like it or not, that's where it's going. And as it turns out, I do like it. I think it's the proper thing to be doing. So if you look out and look at my view of the desired future state, it's much of the way you've got it written down.
Well, I've only written
or you've got the framework.
Schematic. Yes, I've written a schematic. I thought about various things that we were deficient in, that we might be able to gain traction with partners, and that we might be able to, in fact, write something coherent that might be able to compete with some of the other folks who are going to apply for this. And obviously, we're not going to have an epidemiologist in Granby. We don't have easy access to traveling nurses. We don't have communication specialists. But by the time you start to deal with a budget just for those individuals, and budgets for the PVPC, and budgets for some other things that we might think are essential, you'd run up more than a couple $100,000 per year. And I think be able to write something, as I said, that might be competitive. The problem with all of this, putting this out as an RFP across the state, is there's only a limited number of these specialized people around. How many epidemiologists do you think are available to hire in the state of Massachusetts to work with various towns? There's not going to be many. There are not going to be many of these people. And the same way, communication specialists, whatever a communication specialist really is. Visiting public health nurse, yeah, I think probably that could be found. But I think I think we could write something coherent, uh, if not on this framework, on some other framework, to present to the state as a serious example of trying to improve the public health and welfare of small and medium-sized towns in the state. So I think we could and would be respectable if we built something on this kind of framework.
My concern, Herb, when I asked myself, why are knowing we've got a week to go, knowing how much there is to do, to say why are we doing this now? Why would we not spend the next 9 months working hard, getting a really firm view of what we were going to do, who we were going to do it, and why would we not get ready to apply next year for this thing?
Well,
And I'm asking you, I'm asking that.
yeah,
It's a question. It's not a statement.
every single troika or trifecta of towns in this Commonwealth is facing exactly the same issue. None of them, I suspect none of them has any major head start on what we're thinking about now. So, yeah, there may be a more studied presentation to make in a year, but maybe not. There's only a limited number of issues that we're talking about here. We're talking about adhering to national standards, adhering to state standards, trying to work cooperatively, trying to improve health in our towns. I'm not sure we're going to have a whole lot more to say in a year, but I don't know that for sure. And this is an opportunity to get involved at the onset with a state mandated program that they want to see be successful. And it's just reminiscent, I think, of discussion that went on a few meetings ago when we talked about the need to broaden significantly if we're going to do anything significant. A town of 6,000 with virtually no resources is not going to make a dent in much. If we were partnered with Amherst, South Hadley, and or Holyoke, I'm not sure that 3 is the magic number. Maybe 4 is a better number. I've not spoken with Lynn. She's part of the Board of Health in Holyoke. What is their idea about this? Are they going to apply? Do they want to apply? Would they want to be involved with us? So
I don't even know if crossing county lines is available.
I'm sorry, if say,
I don't even know if we're allowed to cross county lines.
oh, I see.
Holyoke's in Hampden County.
I see.
I know that. I don't know.
Yeah. Well, I've tried.
My concern is, Herb.
Yes. Go ahead.
Was Lee what you were going to speak?
No, I was just clicking through my, I got the phone here, but I'm just going through the computer looking at, I was revisiting some of the 116-page documentation that I read last night, just reviewing some parts of it right now. But that was one of my concerns, and it's not founded on fact, just on wondering if we can go from Hampshire County into another county, and if that's okay, or if it's chopped up jurisdictionally. I don't know that.
Well, we didn't hear that in the Thursday meeting, that was verboten. What we heard was it wasn't 2 towns, it was 3 towns as a minimum to put together a shared service proposal. Lee, did you have a chance to look at my my discussion draft, my preliminary
I did.
attempt
Yes.
at trying to set a framework?
Yes.
There was only so much I could write this afternoon. Well, and some morning.
I get that. And, talking, and it may or may not be pertinent, but talking about Holyoke, I know Holyoke has a bunch of resources that we don't have, and they may be earmarked for a lot of money based upon a poor population compared to us. Whether that means there's more money floating in, I'm expecting that there's going to be. The hospitals there, there's a lot of good things that possibly, if we could grab onto their coattails, we'd benefit from. But again, as it was said earlier, I don't know if they would want us, or if we can cross that invisible line in the sand to join them.
Yeah, none of the money from this grant, it's my understanding, goes to support any of the current positions in town. This money is to enlarge the purview of services. This is a grant to fulfill the public health issues, not to release towns of their responsibility to support their employees.
Agreed. That was my impression.
Yeah.
I lost my train of thought. So and I don't even know where to start. Can we get a hold of somebody at the state or at the Holyoke level to see if they would have any interest or any feasibility of going in that direction, given the time frame that we're dealing with?
Well, Phoebe Walker, who was one of the people heading the discussion, would probably answer an email pretty quickly. We could try emailing her and see what her response is. I have to say my personal first choice is Amherst and South Hadley, with the caveat that I don't understand Sharon Hart's reluctance. But I added Holyoke when I thought, gee, Amherst is going to have a whole lot of options probably. Since Emma came from Hadley, she could probably easily work with Hadley. And I don't know what other town or towns. Emma is a good person to work with. I can tell you from our homebound vaccination program, she is a pretty dynamite person to be involved with.
Okay. Yeah, I mean, I'm just thinking aloud. I've spoken to several guys who work at the that Holyoke Health Center pharmacy on Maple Street, and they really are well funded as far as taking care of the indigent population. As far as the opioid crisis, managing their diabetes care, there's a bunch of money flowing into that place because Holyoke is earmarked as a city in need. And again, the funding is not going to solve the problems. It's the right people in the right place. And
Well,
Amherst, a big crowd with UMass, and that's a separate entity, but there's a lot of big population as well. How much difference between the two cities? I have no clue.
well, data collection, data management, data justification, data trying to make sure it's right. All of these things are critical issues that I don't suspect is terribly vibrant in any of our towns, certainly not in our town. So an epidemiologist, statistician, data manager that would work cooperatively with other towns could be a boon for the state to get good information. Let me
Herb, if I were looking for a best and a desired group, I agree with you. The uh, 4 towns that are physically close, that are kind of the same. When you look at Amherst, Hadley, South Hadley, Granby, that's a very natural group that,
right.
And as you said, if you look at Emma's link into Hadley, if you look at our link into South Hadley and
Yeah.
say, boy, why, if you could work those 4 people, towns together, we probably have the right links to make it happen.
But not only that, Dick, I think you'd have an incredibly strong application, assuming you put the right things in. And I'm not saying what are the right things. This just came out of my keyboard today. This is a first draft. This isn't even vetted in any way. But what I might suggest is labeling this preliminary discussion draft or the most preliminary discussion draft, and send it to Emma, maybe send it to Sharon, maybe ask Emma about her connections to Hadley to see whether this is something to build on to develop a shared services application. Because unless we start talking to these people pronto, there isn't going to be any chance to do anything. This is a day's worth, but we have a week, and this has to be in as a final,
right?
A final application with a budget, with something that's been vetted by all of the participants. There isn't any time to do anything except act or decide that we don't want to act.
I'd offer that you're right. That my feeling is there's not enough time to do it, but I don't want to. It's this thing. What you have written down on paper is going to happen. That part is for sure. That's going to happen. So now I could support going to those 4 towns with your document and say, look at, and maybe it's because Emma is on the Hadley Board of Health. Sharon told me that Emma did not resign from the Board of Health. She took the job in Amherst. So
Ah,
you definitely have two towns that dealing with Emma gets two towns out of the way. And I don't mean out of the way, but at
I
least
under,
the communications. So,
right.
so it sounds like what you're saying, I could support what you're saying, is to say, can we four towns or five for those four towns, and you as yours is a base document that says this is what we kind of like to do together, guys. Are you guys willing to talk about this? And if they say yes, then we go forward. We could move or try to move forward. I have my doubts that we can do it, but I don't want to give it up without trying to do it.
Well, I
I do.
totally agree with that. I totally agree with it.
Lee,
It may
what
not,
is your
Yeah, we have
what
to
Herb?
take a fresh. Is that something that we should make a motion right now and at least begin?
Well, beginning, the problem, as Herb is just saying, this is not a leisurely stroll that we're going to just try to get on. This is something that says tomorrow morning, if we're doing this, tomorrow morning, someone's got to be doing something.
that's right. This, as you see, I've put together some fluffy stuff in the beginning, and and then I get to the summary of the proposal. Of course, it's a summary of nothing since we don't have a proposal, but it's a presumed summary. And then I've got some objectives and program designs, all of which have to be fleshed out. All of this stuff. And that doesn't mean it can't be done quickly, but there's a lot of stuff to do. And
It's
before undertaking it, we have to have some agreement with other towns that they want to do it with us. And I am not proposing that I'm the guru here. Anybody can be the head of this thing. Emma can be, Dick can be, I don't care. I'm just trying to respond to what I think the state wants us to do, which is to become better, a lot better. And they're giving us the potential to get money to get a lot better. So I think it would be remiss not to try and do it.
then the first step, I think, has to be to see if we've got willing partners. If we don't have willing partners for at least a view, as I talk about the desired futures, if they've got a different view of that, or they don't want to work with us, then I'm not for moving forward. But if they do, then then maybe we can also get their help to finish this thing off.
Absolutely. Absolutely. This is, if we're going to do this, this isn't going to be written solely by Granby. This is going to be written by the people who are participants, who are going to have to vet it and add and subtract and do all that. Well, uh, may I
So how do
suggest
we
again?
do, Lee? Are you is Lee? It sounded like you were willing to make this next step to try to contact and see if we've got willing partners. Is that true?
That's correct.
Okay. So we know that's what we're going to do. Now the question is, who's going to do it?
Mm-hmm. Well, maybe it should come from the Board of Health. that the Board of Health has developed a preliminary discussion paper, and we would like to see whether they would want to join us in fleshing this out into a full grant proposal to respond to this RFP.
Okay, here's what I'll offer. Let's use our own personal links that we have, and let's see if we can put those to work. So we won't give this to one of us. We'll give it to two of us because it's not going to believe very well because he's running a business. So Herb, what if you go in to make contact to Emma
Yep.
tomorrow, and with the goal of doing the Granby Amherst Hadley link, and I'll go to Sharon, and let's see if we can pull these things together. I've got your document. I will ask Sharon to look at it. It doesn't take very long to read.
Right.
And do some talk with Sharon. Because it does, if we can pull this off, Sharon's, as I said, Sharon's goal was to be linked with Granby and Hadley. So if we put the fourth thing, if we get Amherst in, and that sweetens the pot for Amherst and Hadley, and South Hadley's happy with that arrangement, maybe we actually can make this happen.
Well,
So you want to do that? I will do that tomorrow morning.
well, I will. Is the form of this now okay to send out? Obviously, the program plan / design, there's essentially nothing there, and it would have to be pointed out. All this has to be cooperatively written and quickly cooperatively written. I'm happy to send this to Emma and see what her response is. You're going to send it to Sharon. You've got good rapport with her. I think that's.
And I'm going to talk to Sharon.
And I will talk to Emma. And I will send this to her tonight. I can't imagine, Dick, since this meeting just took place on Thursday, that very many, if any, of the towns have more on paper right now than we do. So I think we should try to do it. If we can do it, great. If it turns out that we can't, then we'll get ready for next time, and we have a nice template here potentially to work off of.
So the next thing is, what do we do for another meeting? It means Colleen can go in. We would have to have, the soonest we can have another meeting is Friday, right?
I guess so.
Yeah, Wednesday, yeah. Mhm.
I think we should do it. And if we get
Oh, we
negative
don't, I
responses,
think you,
if we get negative responses from South Hadley and Amherst / Hadley, we're not going to need the Friday meeting.
but we can cancel it.
Exactly.
We can cancel it, but if we don't schedule the meeting, then we can't have the meeting, and then we're waiting till Tuesday. And that if we wait till Tuesday, that it's gone.
Right. So I think we need to have buy from participants and active writing this week, active writing, so that this thing can get vetted over the weekend, put into final form, and then get ready to submit. We have to be writing this week. This is just a draft. This is nothing more than that. This has to be totally fleshed out.
And it's not even really a draft. Not even really, it's not a full draft. As you said, it's some parts are okay, some aren't there.
Exactly.
But
This is fluffy, but it's at least something to respond to. That was my point. So I'm willing to take this and I will send this by email to Emma and I will speak to her as soon as I can speak to her. Okay.
okay, when are we gonna get together? I'm not
Well,
sure it needs to be a long meeting.
no. Uh, well, I think we need to be communicating with Colleen as to what the results are of our explorations with our other towns. And perhaps Colleen can then distribute that information to the rest of us.
What
Lee,
time do
are
you want to
you-
meet Friday?
Can you break away at Friday during the day for a half an hour or something that
Sure,
just to touch bases?
sure.
Colleen, the earliest you can post this is gonna be at 9 o'clock tomorrow, and I've gotta go and I've gotta give you some Zoom numbers so you can put it in. So is 10 o'clock okay for you, Lee, on Friday?
Yeah, we'll make it work.
Okay. Then why don't you
Okay.
do that? I'll send you the Zoom information. Colleen will do it. So when you go in, when you get in tomorrow, you'll have the Zoom information.
Okay,
Very good. All right.
sounds good.
We can get blown out of the water here, but at least we'll give it a shot.
Well, if we get to the point of submitting this, it will not get blown out of the water. We may not get to the
Oh,
point.
no, I'm just saying, right, that's right. I'm saying blown out of the water because this is a big chunk. It's the right chunk to take.
Yeah.
But whether the other 3 towns are ready to do it right now, okay. Then
Okay,
we'll let Colleen know how we did and she can distribute it.
do we need any kind of motion in this regard, or is this just pretty natural to move ahead?
I don't think so. I think we've got assignments that we agreed
Good.
that's what we're gonna do. We don't have an action plan yet, other than to do some probing.
Excellent.
Sure.
Okay, good night, everybody. Thanks.
Thank you.
Okay,
Okay.
good night. Good night.
Thank you.